Good Saturday morning to you and welcome to The Sleep Show. Alongside Dr. Bethaney Brenner, I'm Gary Byron. You can find her online at theburlingtondentist.com. She's out of Burlington, Connecticut is where you can find her offices. And if you've got a question that you think she could answer, maybe you can think other people would benefit from hearing the answer. I'm going to give you an email address and just indicate if we can, ask this over the airwaves, maybe as soon as next weekend, or if it's something of a personal nature, obviously you want to indicate that. Send that email to drbrennerradio@gmail.com. Brenner is Brenner. More importantly, I want to give you a phone number, and I also want to give an offer to you, provide an offer to you that I think will be too good for you to refuse, because it's a $250 value, and that's a pretty comprehensive sleep assessment. And I'm going to have the good doctor actually give you more. She's more qualified, obviously, at this than I am, certainly. She'll give you an idea of what this assessment entails, because, like I said, it is comprehensive. More importantly, I want to give you the phone number so that you can get this. Again, it's a $250 value. You, however, be one of the first 5 callers. You'll get it absolutely free. 860-673-7155. I'm saying this slowly. I want you to write it down, but I also want you to call it right now. 860-673-7155. Now, I know we're doing the show. Operators are standing by. We want to hear from you. And if you missed any of those points of contact, no worries. I'm going to give it to you a couple of more times before the show is over. Dr. Bethaney Brenner, good to see you. Good morning to you.
Good morning.
How are you?
Good as always. I'm getting my garden going, so I'm always happy about that.
It is that time of year, isn't it?
It is, and I love what I put out there. I just keep praying for better weather.
I had a question that popped up since last week. And I don't need an exact number, but however many people there are here in the United States, is it 3 billion or something like that? I don't know. What percentage of people, men and women, all backgrounds, all ethnicities, all colors, all walks of life, we'll just put it that way. What percentage of people have a sleep disorder? And the companion question to that is, what percentage of that percentage go undiagnosed, where they don't, because if you live alone,
right.
Sometimes, I think you said last week, the person could wake themselves up from snoring. But if you live alone, and let's say it's
right.
not that severe, you may have it and not even know you have it. So there's 2 questions in one. Would you even know any of?
I don't have an exact figure from
what
more
percentage
recently,
of people have a sleep disorder?
I would think that you have anywhere from 85 to 90%.
85? I wasn't expecting that. I thought it was like 50-50.
Here's why.
Holy cow.
The majority of people, and you have to remember, we started doing orthodontics back in the 70s and 60s. What did they mostly do? They took out teeth because they didn't know to expand the palate. I see a lot of people that have what we call a 4-by extraction. They took out 4 permanent teeth to close the gaps and push your jaw back more. And I was one of those kids, okay?
You had to have those teeth extracted?
I had those teeth extracted. My airway was made smaller, okay? Oh. Instead of looking at the whole face and how the whole body functioned, we made pretty smiles. So there were kids that didn't get that done, okay? But we also need to look at the face. So if we look at faces and we see people who have not had any orthodontic, okay, their jaw's retruded. You see somebody who looks like they have no chin. We look at people and their chin's too far forward. They have no mid-face, okay, where their cheekbones
like a sunken-in
They have
cheek.
A sunken-in face. They're and so some of these people, I say to them, so do you think your ears look too big, your nose looks too big, okay? Mm-hmm. And that's because the face isn't proportionate. And why is the face not proportionate? Because the face didn't grow normally. Now, some of this is related to tongue tie. Some of it's related to genetics, okay? But either way, we were still at the forefront of understanding how the face develops and all of that sort of thing. So I see a lot of people that have some form of sleep apnea, of some form of a sleep breathing disorder. Is it bad enough that it causes you to need something? Usually not until you're older. And why is that? Because men's testosterone goes down and you start to see them start to snore. We sort of have accepted that older men snore. Like if they get into their 40s or 50s, oh yeah, they're snoring. Moms get into it when they get into menopause. And it's not right away. And I've mentioned this in other shows. It skyrockets into sleep apnea. And because of her hormones are now disrupted. So why is that? Why does that happen? Well, our cortisol levels go up. We gain some weight. We get some fat put on around the neck.
Oh, you age.
We all think it's age.
Right?
Can we fight that? Can we change that? Yes, we can change that.
You can fight getting older?
Well,
how do you do that?
Not the chronological age, but you can fight. You can fight putting on the fat around your neck.
Yes, that you can, but you can't fight aging.
You
if you can, let me know because I'll be the first one in line.
Well, they have some stuff out there today. We won't get into that at the moment, but yeah, there are things that people are doing, okay, and they're having pretty good success with it. We can get into peptides and all of that other stuff in another show.
Okay.
But yes, you can fight aging to a certain degree. The clock is still going to move forward. So why do some people live to be 100 and they're doing pretty good, right? But we also have people that don't make it past 60, right? So you have to kind of
habits.
Well, some of it's habits, some of it's medications, and I hate to say it, but they did this study in England when they had a strike by their physicians and everybody closed down. It was like 3 months. The death rate completely dropped during that time because people weren't having surgeries and they weren't taking medications and all of that sort of thing. So you have to look at it as some of this created by our medical profession. So I have listened to the medical profession and have been disappointed from time to time in their answers and how they want to address that. And so I've gone a completely different route. I don't deal with a primary care physician anymore. I'm sorely disappointed in their answers, which are pushing drugs. And I have gone other routes, and now I'm not on any medications. So I take supplements. I make sure I do things that are going to keep me healthy, and I changed how I was living my life.
Who do you think suffers from sleep apnea more, men or women?
Suffers. That's an interesting word. I would say the women, because they feel the pain more than the men do, like 7 to 1. Yeah, women will have more discomfort, and that will bring them in. They will have more pain. Men, the testosterone protects them, and they don't have the pain. Do they still have the problem? The answer is yes. They just don't know it.
As you age, your testosterone level will decrease.
It does, but you can also supplement it. You can add testosterone.
Safely.
Yes, you can.
Yeah.
Women, we have the ability to have bioidentical hormones now. We've had that technology for 25 years, if not longer. We don't have to take horse urine. You don't have to do that.
Oh, no.
You know,
is that real?
Well, it was.
Somebody would take horse urine? Do what with it?
That was where they got the hormones from horse urine. Now we have, and these studies are out there. The girls who are taking the birth control pills, the chemical birth control pills, we actually see an increase in cancer in that group. And now we're letting them have it over the counter because it's more important to not get pregnant. I understand that. But there's the other side of maybe we could just not do it. There are other ways to go about things. And I'm not saying I have the answers for everybody. But I've chosen to do certain things. I've never smoked. I wasn't a big fan of smoking. I have a sister who smoked. You know, did she have problems? Yeah. So there are habits like drinking too much. The same thing. We can do things that will age us more quickly.
Well, everything in moderation, they say. There's common findings, right, with head and neck problems. You showed me right before we went to air. You showed me an illustration. And there's problems with people's where you have forward head posture.
Exactly. So that's part of the assessment that I do for people. I actually have them stand and then I have them turn and rotate. I'm looking for the forward head posture.
What's the link between that and a sleep disorder?
Oh, it completely cuts down your breathing by 30%.
And consequently, it has to do with neck posture?
So nasal breathing, and you've heard me talk about this so many times. I go back to this. It is one of the most important things I talk about with patients. We need to be able to breathe through the nose. The trouble is that if you go, I breathe fine. I think I breathe fine. I thought I breathed fine. When I was learning all this, I was like, wait a minute, I don't breathe fine. Oh my God. So you need to understand that the minute you don't breathe well through the nose and you start mouth breathing, the head's going to come forward. And so I do this little kind of explanation with my patients. I say, so when you can't breathe and you fall on the floor, what do people do? They do CPR, right? So what do? They do a chin tilt. What does the chin tilt do? It puts your head back.
So it opens up your airway.
It opens up your airway, okay? Now,
I was certified.
Now, if I stand up and my head is in that position, I can breathe better, but I'm looking at the ceiling. And the brain goes, oh, no. You can't run away from the saber-toothed tiger like that. I need to twist your head up so that you're looking down at the floor so you can see your feet and see where you're running. So we do a torticollis of the cervical spine. So which is that? What does that mean? It twists. Typically, one shoulder becomes higher than the other. Okay? And it's subtle. So I say to ladies, so which side does your bra strap fall off of? Which side do you carry your purse on? Okay? And they go, oh, right. Because it's so like we don't know that this is happening to us, right? When I look at children and I see their forward head posture, when we treat these kids, they upright. Now, is it easy to do when you're 70? The answer is no. I can't straighten you out. It's like you're already sort of stuck in some of that position. So this is where we have appliances and we have CPAPs and we have other things to help you breathe, right? Diet changes. And if you're willing to do those things, not everybody wants to change. So I got it. But as a child, we can actually very much affect that growth pattern. They can't. So this is where sitting straight at the table, sitting upright. There are little exercises you can do. You can actually lean against a chair or even your car seat and push your chin back so that you press the headrest. Okay, that does a little exercise. So what is that doing? It's strengthening our neck muscles because as we come forward, these neck muscles get stretched out. Okay, and when they get stretched out and now you have a torticollis, I look and I see a head tilt. Not everybody has a head tilt, but usually when the bite changes, because when the jaw comes into that bad position with the head coming forward, we start to see TMJ problems. Okay? So what happens when the TMJ problem happens? Now we get a bite problem. Now we're grinding our teeth. Now, and it's this very slow sequence of events that starts to happen. And you sit there and you go, well, I'm not that bad. Well, did you crack a tooth? Did you need a crown? Did you break a filling? Okay? Those are the subtle little things. And you think, oh, that's not a big deal. Everybody does that. I bit down on something. Okay. So I was in a car accident and I thought, okay, why did my C4, C5 area have a problem? That's exactly where the forward head posture, because I didn't know that I had sleep apnea at that time. That's exactly where I had my discs blow out.
Oh, really?
Okay. So I have a neck fusion. The neck fusion creates a problem too. We can get into that at another time. But the point is I had no idea I had a problem. I didn't have it badly, but I was into menopause. Okay. So when you start getting into menopause, what did I say? You skyrocket into sleep apnea. I would have told you I slept fine. I sleep like a baby. I don't have a problem, right? I didn't have an unhealthy lifestyle, but yeah. I still had it. Nobody asked the question. Nobody tested me. Nobody said, oh, do you have a problem breathing through your nose? I would have told you, no, I don't have a problem. And that's why when you come in for this assessment, I'm looking for the things that nobody's looking for.
Well, okay? More reason. So what specifically happens with forward head posture? I mean, you explained how we get like that, but what importance does that have?
So for every inch, because this is a pretty big, heavy bowling ball we got on the top of our shoulders, okay?
Some bigger than others, by the way.
So for every inch, and you think inch is not that big, that you go forward of, I'm going to say normal, where you're postured over your spine and you're straight. For every inch, there's 10 pounds of weight that's on your cervical spine. And where does it hit? Mostly C1 to C6, right in there. So in the beginning, it might only be C1 or C2, and that's where you start to get the torticollis, because the body's going, I need to breathe, and I can't see, so I'm going to twist your neck up a little bit. And when I twist the neck, things start to, it's once again, the death by 1,000 cuts. It's just so very slow. So now you go 2 inches forward. So have you ever been in the airport and you watch people and they're walking along?
It's the best thing to do in the airport.
Exactly. So they got the cane and they're walking along and they're looking at the floor because they can't straighten up. They can't straighten up. All you have to do is go out there and watch. I sit and I watch the kids playing on their phones. Every single one of them almost has their mouth open. And I'm just watching. I don't know who they are.
What's the correlation between playing a game on your phone and your mouth open?
Well, they're not nasal breathing, are they? And now
they're breathing through their mouth.
They're breathing through their mouth, and now they're forward head postured and they're looking down. I thought it was interesting because I saw a chiropractor many years ago, and mostly for her acupuncture, okay? And the kids would all come in after school, and I'm looking at this room, and they're all laying down on a little bed with little weights on their foreheads to try to straighten out their necks. This was 15 years ago. Mm-hmm. And I'm looking at this and I'm going, wow. So I said, why are all these kids in here? Oh, well, they have forward head posture and we're trying to straighten out their necks. So they put a weight on the forehead and they lay there for an hour. Okay? I'm just saying.
Am I missing something here?
Yeah. Once again.
What is? What does
they're going to a chiropractor who's putting a weight on the head to try to straighten out the neck.
What is this, in the 1700s?
Just telling you. Do they get an adjustment? Maybe they get an adjustment. I'm just looking at a room that's filled with kids that have these weights on their heads. Okay? So can you do that at home? You could probably do it at home. But so I talk about this because people don't know what to do to fix it, right? So they're grasping at things. Maybe somebody suggested when this doctor was at a course that said, oh, you should try this. Maybe it works. I don't know. I've never done it. But is it a thing? It could be. Have I seen it work? Not as well as breathing through your nose. So you have to, so that assessment, that forward head posture, it starts to crunch the lungs. So you're breathing, you can't take a deep breath. When I look at the body posture and I look at these people, some people have a scoliosis. Okay. Now, remember when we were kids in elementary school, you had to go down and everybody lined up and the school nurse bent you over?
Oh, yeah.
Remember those days?
Oh, yeah.
Yeah. I don't think they do that anymore, but we all got checked for scoliosis. All right. But some scoliosis isn't as bad as others. Right. And why is that? Do you ever thought, like, why do we get scoliosis?
Well, everybody's different.
Right. But what causes the scoliosis? See, that's where my brain goes. What causes it? Why you, not that person? What did you do differently?
Could it be hereditary? Is it environmental? Is it dietary? Is it?
I think so we talk about environmental. So if you're doing things differently, maybe you got put in the crib crooked. I don't know. Maybe you sat in your stroller and didn't sit straight. I don't know.
Folks, you are listening to The Sleep Show along with Dr. Bethaney Brenner. I'm Gary Byron. You can find her online. By the way, her office is in Burlington, which would make sense since her website is theburlingtondentist.com. I'll give you the email address more towards the end of the show, but let me give you the phone number. There's a reason why. Write this number down. And if I don't want you to miss any part of the show. If you want to call it at the end, that's totally fine. 860-673-7155. 860-673-7155. First 5 callers are going to receive a free sleep assessment. It's a $250 value. And if you're wondering, is it really that? Yes, because it's very thorough. It's comprehensive, which is... You're getting your money's worth at $250, but for you, you're getting it free. So we'll give you more details on that more towards the end of the show. Who fixes all this? I mean, you see a lot of problems.
Yeah. So
are there problems that can't be fixed?
Well,
also,
let's talk about the problems a little bit more.
Yeah.
So when you start to have this problem, what happens, right? So we get people who get, and I'm going to say this is pretty common. I see on the assessment forms that I give people, they get shoulder pain. So I had one young man, he was, I don't know, 20-ish, in college, and he said, yeah, I had shoulder surgery twice on my left shoulder. I said, why? Well, I don't know. I said, well, did you? He said, I had pain there. I said, did they find anything when they did the surgery? No, but they did the surgery twice. So when I looked at him, forward head posture, couldn't breathe, needed expansion. So when I look at these kids, so once again, it's like check off the boxes, right? What am I looking for? They get numbness down their arms. How many times have people told me, oh, I wake up at night and my arms are killing me and I can't even feel them. My fingers are all tingly.
Oh, that could be, is it Raynaud's?
No, that's not Raynaud's. Raynaud's when they get cold and turn white, blue.
Yeah. But
that's
if you
different.
get numbness in your legs or your feet, or
That's different. This is down your arms. Okay? Wakes you up at night. Why? Because of the way you're sleeping with your neck. Okay? So sometimes we can use neck pillows and that will help straighten it out. But it's another symptom of what happens to that cervical spine. Okay? C1, C2. So, and I say this all the time to patients. I said, so has your bite changed? How many times have I heard, yeah, my bite changed? Okay? All right. When did you first notice it? Right? So we get into these conversations and some things is pretty lengthy. Some people, I'm like, I know exactly what's going on and I need to help them in the moment. And then I have to go back and finish all my questions. But when you have somebody who has no clue, I have to start from ground zero because they're like, what are you talking about? I'm fine. I don't have a problem like that. Okay? How many people tell me about carpal tunnel?
A lot of people have carpal tunnel syndrome.
It's a neck problem.
I thought it was in their wrists.
No, it's a neck problem.
See, this is why you got to listen to this show. You learn new things every episode.
So, did they do the test to make sure that it's the hand or the neck? The answer is no. They go in and they go, I can fix this and I can do surgery right into the palm of your hand. Did that fix the problem? Some people, it definitely alleviates some of it, but it's really a cervical issue. Nobody's looking. That's why I say that. I can't say it's 100% true, but a lot of people, I sit there and I go, did you get your neck evaluated? Because they can do a test. It's a painful test, but it does work. I've had it done twice. Yeah. And because I had a problem into my shoulder after I had the car accident and blew out the disc in my neck. I was like, I didn't have any problems for a whole year. Also, whiplash from car accidents, you don't see the effects on the jaw for a whole year. People don't connect the dots. Okay? So I get this lady who comes in and she's got all these problems and I'm like, she's like, yeah, I was in a pretty bad car accident, hit head on when I was 16. Okay. She was in the front seat. She had to have facial reconstruction. Then she was in another car accident just a few years ago. Rear-ended pretty severely. Her car was pretty mushed up. So she's like, oh my God, but I didn't have any problems right away. La, 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 right? It's a year later. So why don't the physicians know this stuff? I'm flat. It's all in the research. It's all in the articles. It's all out there. Go on PubMed, Google Scholar. It's out there. Why don't they do that? I don't know, because you know why? They make money when they do the surgery. I hate to say it like that. And I'll tell you my knee story sometime. They kept telling me I needed knee surgery. I didn't need knee surgery. Good thing I know how to go and read articles.
Good thing you're doing this show is what I'm thinking.
Yeah, so can I say 100% you don't need a hand surgery? No, I'm saying they need to look at the neck. They need to make sure that that's not where the cause is. Because I've woken up many years, not every night, only once in a while, I'd have pain down my arms. I'd have numbness down my arms, and I couldn't figure out what was going on. It wasn't all the time. So as a kid, you kind of go, oh, I must have slept crooked, right? You excuse it away. So all of these little things.
Well, sometimes it goes away in 2 days.
Yeah, sometimes you pinch a nerve, right? And you go, oh my God.
Perfect example.
I'm like, right? So what is that? What is a pinched nerve? Do you know what causes the pain?
No.
The muscle cramps. And the muscle squeezes down on the nerve that's there.
Yeah, and it's gone in 48 hours.
Not always. Some people have to go see a chiropractor. Why do they go see the chiropractor? Because the neck got screwed up. Okay? That disc either slips forward, slips backwards, and when I'm doing that assessment, okay, I'm looking at your neck.
Go into this assessment. Take a couple of minutes now and give us an example of some of the questions. You said it's very lengthy.
Yeah, so I go over your entire medical history, like the drugs that you take, what's happened to you, any surgeries that you've had, right? Have you had orthodontics? Because a lot of times the orthodontics wasn't always done so well. I mean, it's not horrible. They got pretty teeth, but I'm looking and they really didn't expand them. They really didn't align them. Their bites are off. There's stuff or they had some dental work and their bites are off. But sometimes it's not the dental work. Sometimes the bite is off and it's because the C1, C2 shifts. One of the things that I talk about, and I ask the patients, I say, okay, so your head sits on your atlas, sits on C1, okay? So we're thinking like a pyramid, right? So you got number 1, number 2. So C1 is sitting there. C1 only has 2 legs, not 3. Like think of a 3-legged stool, right? C1 only has 2 legs. Why does it stay stable? See, you don't know either.
Balance?
So what balances it?
Having all 3 legs.
Yeah, but you don't have 3 legs. You've only got 2 with C1.
Oh.
So why does it stay balanced?
That's a good question.
It's your bite. Your bite is the 3rd leg. And so why do people get strength? Like think about football players, right? They squeeze their teeth when they're doing a certain maneuver, running, lifting something heavy, right?
Clench your teeth,
what does that do? It stabilizes your spine. Think about it.
Oh my goodness.
Okay? So you get more, so that's why they started making very specialized sports guards for the professionals, because they actually increased their strength by putting them in a perfect position while they were playing football. Now, they've been doing this to the guys out of Notre Dame, and I know the dentist out there, and I'm like, I hate him already because he makes sure that they all get the good stuff. But, so their football teams are good.
So this assessment is very comprehensive, but so if you're paying for it, if you're paying the $250, you're certainly getting your money's worth. But for the first 5 callers right now, you're going to get this $250 value of this sleep assessment absolutely free. Call right now. The show is winding down. I'm going to give you the phone number, 860-673-7155. I spoke too fast. Let me give it to you again. 860-673-7155. If you want to send an email, or you have a question, if it's personal, make sure you put that in a notation. Send it to Dr. Brenner Radio at gmail.com. Brenner is Brenner. If you think it's a topic everybody can benefit from, make that indication as well. We could get it answered maybe as soon as next weekend. Your office is in Burlington, which is why the website is theburlingtondentist.com. For Dr. Bethaney Brenner, I'm Gary Byron. Thank you so much for listening to The Sleep Show. Until next Saturday morning, have a good one, everybody. So long.